So what's the future of outpatient physical therapy? Recently there was a blog post that, or maybe in a conversation that someone posted, what place will physical therapy have in the ACO healthcare model? And for those who don't know what an ACO is, it's a accountable care organization. And what it is these huge massive groups are going to be formed, and either the physicians, the hospital, or the insurance companies is going to own the ACO. And the ACO is going to be made up of all sorts of healthcare disciplines, and from anesthesiology, surgery, everything, and physiotherapy. And the question is, where is physiotherapy going to get placed on this ACO model? I feel physiotherapy is going to be a pawn on the chessboard with this one. It's going to be at the very bottom. And if they're going to give one check to the ACO for a surgery or a procedure, whatever is left over is going to be left over for the physiotherapist. So, if a total knee, for example, if a total knee is being done, by the time the surgery, the anesthesia, the medications, the operation is done, and it's time for physiotherapy, whatever is left over is going to be left over for physiotherapy. And whether it's $500, whether it's $1,000, whatever's left over is going to be left over for us to deal with. And then we're going to have to either take the hit, or what's very sad to see is that some patients are only going to be seen like 6 times for a post-op rehab, and they'll discharge the patient to a home exercise program before the goals are met, or before the final outcome is actually relieved, because they don't want to take the hit. So they'll discharge the patient early, and I'm seeing it happen. So what is the future of outpatient physiotherapy? Many private practices are being bought up. I don't think physiotherapy is going to be anything big in the ACO model. I think a lot of private practices will either go out of business, or they'll get bought out, or they'll end up joining the ACO. So I don't think the future is bright for outpatient physiotherapy, and that's why I started the cash-based clinic. It's truly autonomous practice. You don't need to rely on anyone else. You can follow medical guidelines and stuff as a medical clinic, yes, but you're not limited by any health insurance company for treatment, for guidelines, for payment, anything. And I honestly think that insurance companies will end up seeing physiotherapy as a non-vital service, and insurance companies will end up probably focusing more on major medical problems like cancer, surgeries, etc., and stuff like that. And physiotherapy is going to be devalued by the insurance company by a lot. We're going to be on the very end. There's not going to be a lot of payment. There's already not a lot of payment. There's some insurance companies that will pay $20 a visit regardless of what you do. So the insurance company isn't going to see the value in physiotherapy. So eventually, I could go on for hours and days about this, but it's a big problem that I think is going to occur in the future, and it's already happening now. What is the future of outpatient physiotherapy? And if private practices can't survive, all the physiotherapists are just going to go work at hospitals or at these ACOs. So what I view, or what I think it is, not just because I'm selling a cash-based system, I really think too that for us to survive healthcare reform and to thrive in healthcare and to do what's best for our patients, I think outpatient physiotherapy is going to need to adapt to a cash-based system. And thus we will still be able to have our place in healthcare, showing great outcomes, it's cost effective, and really helping the patients that could benefit from us most. So I think, or I see, physical therapy, going towards a cash-based system in outpatient orthopedics or any kind of really outpatient setting. So this is where I see it's going. I know one thing, I'll never go back to standard insurance physiotherapy. I'm in cash-based for good. So if you have any questions, send me an email about it. Let me know what you think is going to happen with the future of physiotherapy, and we'll have an interesting discussion. Thanks.